Are you having trouble sleeping at night? Do you feel anxious or sometimes have heart palpitations? Or maybe your hormone therapy isn't working well. If you've tried conventional testing but still don't feel like yourself, don't give up. There are other options. In fact, neurotransmitter testing may be your answer, and today we're going to discuss that on Sunflower Shop TV. Today I've invited Shelly King from a company called NeuroScience. This company has revolutionized the industry when it comes to neurotransmitter testing. Today I'd like to welcome Shelly King from NeuroScience.
Thank you very much for having me.
Shelly, first off, tell me, what is a neurotransmitter?
Well, quite simply, neurotransmitters are the chemical messengers of the nervous, endocrine, and immune systems.
And what do they do? What do neurotransmitters really do in the body?
Neurotransmitters carry the nervous system's communications to and from the rest of the body.
What factors contribute to the imbalance of neurotransmitters in our lifestyle?
Well, you just mentioned lifestyle choices, lack of exercise, poor dietary choices, stress, who doesn't have stress, and even hormone imbalances can cause neurotransmitter imbalances.
So what are the few of the symptoms that really come out when we have neurotransmitter imbalances?
Well, you might be surprised, but very, very common symptoms such as lack of energy, trouble falling asleep, or even trouble staying asleep, anxiousness, low mood, and even weight concerns, and again, back to hormones, hormone imbalances.
I know many doctors in this area who are using neurotransmitter testing. Does insurance cover this?
Actually, you might be surprised, but insurance covers these tests very well. And let me expand on that a little bit. When I say covered, there is a difference between that and the test being paid for. The difference is that when a test is covered, it means that an insurance company sees the value of the test and says, you know what, we are going to go ahead and cover that. But if a patient hasn't met their deductible, then the patient is still going to have to pay for the test. But once a deductible is met, in many cases, the insurance company does pay for the test.
So I see this big kit. This is what the customer would get, right?
Absolutely.
A kit like this from their doctor or healthcare provider.
That's correct.
So how is it administered?
Well, it's a very easy test in that it's non-invasive. So a healthcare practitioner is going to give a patient this test collection box. The patient's going to take it home, and then he or she will provide a urine specimen and fill out the paperwork, letting the company know why they're doing the test. The paperwork and all the collection materials are inside this box, and then on the day of the collection, they're going to put their specimen in the refrigerator, and then the next day, they're going to attach the prepaid UPS label that is also included in the box to the outside of the box with their specimen and the paperwork inside the test collection box. They're going to send that to NeuroScience, and then once NeuroScience gets that test collection box, within 5 to 7 business days, NeuroScience will send the healthcare practitioner the results of the test.
So when the healthcare provider gets those results, how does he use that information to help the client?
Well, if neurotransmitter imbalances are shown, and in some cases even hormone imbalances, some of the tests do test adrenal activity, the healthcare practitioner is going to sit down with the patient and let him or her know that there are imbalances, again, if they exist. And then the healthcare practitioner is going to make choices as to how to address those imbalances. If he or she chooses, NeuroScience does offer a supplement line that is specifically geared toward neurotransmitter imbalances. And these supplements are actually not only to provide symptom relief, which of course is the most important thing we're looking for, but actually, in addition to that, to make biochemical changes in the body so that when you retest 2 or 3 months later, you can see that the markers have actually moved. For example, if you had low serotonin when you first tested, then after 2 or 3 months of using supplementation, that serotonin should have gone up. We have products that help balance all kinds of neurotransmitters. For example, back to serotonin. One of the precursors to serotonin, meaning a building block that helps the body to make serotonin, is called 5-HTP. And we have products that include 5-HTP, which in turn helps the body to produce the serotonin that it should be producing in the first place.
Your company has done a lot of research to see the connection of different systems involved in neurotransmitter testing.
Correct.
What are some of those systems?
The systems that relate to neurotransmitter testing and imbalances in general include the nervous system, the endocrine system, and the immune system. There's a very intimate relationship between those three in that you've got to have balance within each system in order to have balance among the three systems, and you've got to have that balance among the three systems in order to get your body to a point of homeostasis, meaning a point of balance, which is what your body always is striving for in order to have optimal health. If you have imbalances in any of the systems, whether it's those three or others, it's going to be very, very difficult to get to a point of optimal health.
So this test can be pretty much used by anybody, especially people who maybe hit a wall or can't get over their hump of what's going on in their health issues.
Absolutely. You know, many neuroscience clients actually use the test as standard of practice. You know, when they first see a patient, they want to know if there are imbalances, and so they use the test on most every patient they see. However, there are certainly healthcare practitioners that are talking to patients like you described, and it's like, well, you know, we've tried this, this, and this. Let's see what's going on with your nervous system, and then use the test for that.
Shelly, that's great information. I really appreciate you being here today.
Thank you very much for having me. I appreciate your time.
If you want more information about neurotransmitter testing and how it can help you, call or visit us at Sunflower Shop, where great health is just our way of life.